All right, today we're going to talk about something that affects millions of men, but honestly doesn't get talked about nearly enough: gynecomastia. Look, this is a medical condition, plain and simple, not some kind of personal failing. And understanding it, well, that's always the first step. So let's get right into it. So let's start with the big question. What actually is gynecomastia? You've probably heard the name thrown around, but the details can get a little fuzzy. We're going to break down exactly what it is, and you might be surprised just how many people are dealing with this. And before we even get into the science, just take a look at these numbers. Seriously, we're talking up to 60% of adolescent boys and up to 30% of adult men. The biggest takeaway here: if this is something you're experiencing, you're absolutely not alone. This is a shared experience for millions of guys out there. Okay, so let's really define what we're talking about here. When we say gynecomastia, what does that actually mean? What does it feel like? Let's get specific and really demystify the whole experience. So here's the official definition. Gynecomastia is the benign, and benign is just a keyword here, it means non-cancerous, enlargement of the actual glandular tissue in the male breast. Now, what's really important to get is that it can be the gland itself, it can be fatty tissue, or pretty commonly it's a mix of both. And that little distinction, it becomes super important when we start talking about treatment. The way it shows up can be different for everyone, right? But the classic signs are usually a feeling of fullness or maybe a distinct, firm, rubbery little disc of tissue right behind the nipple. It can be tender to the touch, and it can even be asymmetrical. One side might be more noticeable than the other. And all of this, of course, can lead to some pretty significant social and cosmetic concerns. Okay, so now we know what it is. But the big question is, why? Why does this happen? Getting to the root cause is the next critical piece of the puzzle, so let's dive into the science. So generally, the causes fall into two main buckets. On one side, you have what we call physiologic, or basically normal causes. Think about the crazy hormone shifts that happen when you're a newborn or going through puberty, or even just as you get older. A lot of the time, this stuff is temporary. Then, on the other side, you have pathologic causes, which means it's tied to an underlying issue. Maybe certain medications, a hormonal disorder, or some other kind of disease. And on top of those two main categories, a bunch of other factors can play a role, and most of them mess with your body's natural hormone balance. Anabolic steroids, for instance, are a direct cause. Even heavy alcohol use can throw a wrench in testosterone production. And obesity is a big one because fat cells can actually convert testosterone into estrogen. Sometimes, though, it's just excess fatty tissue without the gland involvement, and we call that pseudogynecomastia. So, knowing the cause leads us right to the next logical question: what can you actually do about it? This next part is all about that journey, from just watching and waiting to taking real, active steps to correct it. The approach is usually a step-by-step process. For a teenager who's right in the middle of puberty, step one is often just to observe it, because a lot of the time it'll go away on its own. For others, lifestyle changes can make a real difference. Things like weight loss or stopping certain substances. Your doctor might also take a look at your medications. But for many, the final step for a really definitive, long-lasting result is going to be surgical. And this right here is a really key turning point. When gynecomastia has been around for a long time, or when it's just more significant, surgery really does become the most effective and reliable way to get that flatter, more masculine chest contour back. I know the word surgery can be a little intimidating. So our goal here is to just pull back the curtain and show you exactly what to expect from the procedures that are most commonly done. Let's break down the main options. If the issue is mostly fat, liposuction alone can sometimes do the trick, and the scarring is minimal. But if you've got that firm glandular tissue, you need a direct excision to actually remove the gland for good. And for more severe cases where there's a lot of sagging skin, a skin excision or a lift might be needed to really reshape the chest. But that does mean more extensive scars. It's all about matching the technique to the problem. So you've done it. You've gone through the treatment. But what happens next? The recovery process and the final results are just as crucial as the procedure itself. So let's take a look at that timeline. Yeah, healing is definitely a process, not a single event. You'll see most of the bruising fade in the first week or two, and the major swelling starts to go down over that first month. You'll need to hold off on hitting the gym hard for about 4 to 6 weeks. And here's the key thing to remember. That final, settled look, that can take anywhere from 3 to 6 months to really show itself as everything heals and tightens up. And if you want to get to that final result as smoothly as possible, these steps are pretty much non-negotiable. Wearing that compression garment is absolutely vital for keeping swelling under control. Avoiding heavy lifting is a must to protect the healing tissues. And of course, the single most important thing you can do is just follow your surgeon's specific instructions to the letter. And really, this quote sums it up perfectly. The surgery isn't just about removing tissue. It's about creating a lasting change. The goal is a physical result that you're happy with, which in turn almost always fuels a huge boost in self-confidence. So, we've covered the what, the why, and the how. The only question left is the one for you. If this is something you've been dealing with, well, understanding it is step one. The next step is starting a conversation with a medical professional. Thanks so much for joining us.